welcome everybody. I know we're still having some come in, but this is session 15, North Dakota Nursing Culture of Excellence and Designation, an Innovative Approach to Recruitment and Retention. I am Tracy Evanson. I'm a professor in nursing at UND and also a member of the Dakota Conference Planning Committee. So happy to welcome you to this session. I'm going to introduce our three speakers, Dr. Patricia Moulton Burwell, who has conducted health workforce research and program development for 18 years. This includes a 10-year statewide longitudinal nursing education supply and demand study that was mandated by the North Dakota State Legislature. She served as the co-lead for the North Dakota Governor's Nursing Shortage Task Force and the committee that created the Workplace Culture Program. She is the executive director of the North Dakota Center for Nursing and the director of the National Forum on State Nursing Workforce Centers. We also have Dr. Rhoda Owens, who is an assistant professor at the University of North Dakota College of Nursing and Professional Disciplines. Dr. Owens' area of research involves nursing workforce intent to stay, recruitment and retention, nurse professional identity formation, and the rural family nurse practitioner transition to practice. She has published in several peer-reviewed nursing journals, and currently she is the North Dakota Center for Nursing Workplace Culture Committee member. She served as a consultant and worked with nurses located across the state in the development of the North Dakota Nursing Culture of Excellence designation and is now involved with the program implementation and evaluation stages. And then we have Ricky Ramlow. Ricky, have you been able to turn your camera on yet?
Turn the light off.
Yeah, I know she's here. She's listed, but so Ricky serves as the Vice President of Chief Operating Officer at Jamestown Regional Medical Center. She is the public consumer member on the North Dakota Center for Nursing Board of Directors and is active in many community organizations. She served on the Governor's Workplace Culture Committee since its start and has been instrumental in the inclusion of rural hospital needs in the final program. All of the presenters have indicated that this presentation will not include any discussion of commercial products or services and will not include any discussion of off-label and or investigational uses of any products or services and will not include trade names. Okay, I'm going to turn it over to our presenters. Thank you so much.
Okay, welcome and thank you for attending our presentation today. We appreciate the opportunity to present information on our research and the process for development of the North Dakota Nursing Culture of Excellence Designation Program. We have three objectives that we will cover during this presentation. First, we will describe the components of the new North Dakota Nursing Culture of Excellence Designation Program. Secondly, we will describe the research used to develop the program and preliminary evaluation data used to determine the satisfaction, retention, and intent to stay. And last, we will provide information about the importance of workplace culture at a rural hospital. Funding for our research and development of our program's research and criteria was obtained from the National Council State Boards of Nursing Center for Regulatory Excellence, also the Blue Cross Blue Shield Caring Foundation, and the Bush Foundation North Dakota Consensus Council. This research and program development project began with the work by the North Dakota Governor's Nursing Shortage Task Force. There were three goals: into nursing programs. Second, expand program focus on rural areas. We specifically focused on retaining nurse program graduates and practicing nurses in North Dakota, because it is known that an adequate skilled nursing workforce leads to increased healthcare access and save quality patient care in our communities. A couple strategies that we focused on related to nursing workforce retention, and they were developed by a large group of stakeholders. It was determined that with the goal of developing this workplace culture framework, the first step would be to better determine why nurses exit the state and their workplaces in North Dakota. We know that the research supports that there are several areas or several reasons why practicing nurses leave their workplace. And these include not competitive salaries, lack of preceptors and mentors, lack of a formal orientation, a lack of nurse residency programs and support, a lack of flexibility and work-life balance, incivility that occurs in the workplace setting, and also lack of patient safety and also large commutes and travel to their workplace. So the research study first completed was called Influence of Professional Quality of Life and Work Satisfaction on Intent to Stay, a mixed methods approach to inform policy and regulation. And this occurred from July 2019 to June 2020. Oops. So we specifically explored intent to stay and intent to leave. These terms are used interchangeably in literature. You may have come across this as you review research and literature on concepts. Kovner and Associates describe intent to stay as the individual's attitude towards staying with their current employer. And on the opposite end is Kovner and Associates describe intent to leave as the degree that an individual has toward the idea of voluntarily leaving the employer and organization. So we specific factors that cause practicing nurses and graduating student nurses to stay or leave North Dakota and their places of employment. We know that healthcare facilities work are recruiting both practicing nurses and graduates for their vacancies, and also want to promote their retention. So this is why it was important to look at both these factors. And so newly licensed registered nurses' work behavior is complex in process. The literature shows, especially, the new graduates and those that are, they have different work that influences their personal characteristics, opportunity for other jobs, and also many workplace attributes and characteristics. So we wanted to further study this related to North Dakota. So our overall purpose of this study was to explore and identify factors that influence graduating nursing students and practicing nurses' intent to stay in North Dakota and in their workplaces, and to develop policies that encourage nurses to stay in the state and workplaces. So since this was a mixed method study, we collected both quantitative and qualitative data. The quantitative data collection was obtained by an online survey. We asked graduating nursing students throughout the state and all the various programs to complete the survey. We had a total of 201 students in all these education programs complete the survey. We also asked practicing nurses, LPN, is a practice from education, hospitals, clinics, public health, community settings, to complete the survey, and had a total of 763 that completed the survey. In the survey, we used several valid instruments. We used Price's intent to stay. We used the STAMPS index of work satisfaction. We also used questions on reasons to work in North Dakota that had been previously tested in other research studies. Professional quality of life, which focused on compassion fatigue, which is composed of burnout and secondary traumatic stress, and also several demographic factors. Here's some examples of some of the reasons to work in North Dakota that were included in our survey. Family lives in North Dakota. We wanted to see what they thought about the education programs, pay and benefits, scholarships, tuition, cost, job opportunities, safe place to live and raise a family, and also whether or not their spouse or significant other has a job in North Dakota. Overall descriptive statistics as far as why practicing nurses intend to stay in North Dakota and the present employer was quite alarming, because only half plan to stay in North Dakota and their employer. So some of our significant quantitative data analysis results include practicing nurses. What particularly of interest to us is they had higher levels of burnout, the greater was their intent to leave their employer. Also, if they perceived good pay and higher levels of pay and good autonomy and also desirable organization policies, this resulted in lower levels of intent to leave. Also, if we were practicing nurses, age was a factor, the older ones, and if they identified more reasons to work in North Dakota, that was associated with lower levels of intent to leave. So as far as the graduating student nurses, so since these graduating student nurses, some of them were enrolled in ADN programs, BSN programs, advanced practice programs. So they were working as RNs and LPNs, a lot of them. And so we looked at their compassion satisfaction, you know, we took them out of the they were looked at as practicing nurses. And so their compassion satisfaction, when it was higher and they had more reasons that they wanted to work in North Dakota, lower was their intent to leave their employer. And then those students that were not working as RNs and LPNs, what the only significant finding we had is the more reasons for students wanting to work in North Dakota, the lower was their intent to leave North Dakota. So we collected qualitative data collection too, and this provided us so much more rich research and data that we were able to combine with the quantitative results. And so we did focus groups throughout the state, and we opened it up to pretty much every nursing program in the state of North Dakota, so those bordering North Dakota and Minnesota. And we ended up doing 29 focus groups with a total of 228 students. 11 North Dakota, these were the programs that they were enrolled in. We also did focus groups with 9 practicing nurse groups, and a total of 48 nurses came to those focus groups, and they were also throughout the state. In those groups, we had RNs, LPNs, and APRNs. They were graduates of all the different levels of programs, and also were working in various practice areas. And then we did collect some demographics on these individuals too, as you can see. But it was interesting that when we combined the qualitative data results in the analysis as we were analyzing the transcripts from their focus groups, we had 4 similar themes that emerged from both these groups. And the first one was competitive pay and benefits. And so all benefits, not just salary, which seems to be a perception out there that nurses just want more pay, but they also want more other competitive benefits, such as support for continuing education, good health insurance coverage, dental, good retirement, and also bonus pay for years of longevity, because they said that everybody caters towards those new graduates and they forget about those that have longevity at their places of employment. That really came out strong. A positive work environment. So they wanted that positive workplace culture, a fun place to come to work, good teamwork, good interprofessional teams. They wanted civil work environments. They want to be able to provide safe patient care, good nurse-patient ratios in their perceptions, and also good role models. Supportive management was very important. And the APRNs wanted to work in their full practice and have autonomy. North Dakota is a full practice state, and there were areas in North Dakota that aren't allowing APRNs to work in that full practice. The third theme was career goals. Career goals. They were all career orientated. So whether they wanted to go on to be an APRN, work in a specific area of practice, especially for new grads, if they were able to work, so for example, OB, ICU, surgical, that was very important for their recruitment, that they were able to do that. Opportunity for career advancement. Cost assistance with obtaining those advanced degrees or getting their BSN or ADN, and so on. And lastly, personal goals and reasons was our fourth theme. And so family lived in the area. Maybe they had a spouse or significant other that lived in the area. Family for them. What was interesting with the rural nurses, and there were a lot of them that were in, is that they were all working at rural facilities in a rural area. Some of them that went on to be APRNs, they were in an APRN program. They wanted to could work as an advanced practitioner in a rural clinic where they were. And so they had just a passion to provide rural health care and also to continue to live and provide that access. So we do have one manuscript that's published. I'm going to leave the reference here. It's on the slide, so if you want to look it up on the qualitative study. We're also hopefully getting close to publishing the whole mixed methods result. It's under peer review, and the editor has expressed interest. We should be hearing any day on that manuscript, so hopefully we'll have a couple of manuscripts published on this study, if you want to read further on the research. So with that, I'm going to turn it over to my colleague, Dr. Patricia Moulton.
Thank you, Dr. Owens. So today I'm going to talk about what happens after the study. And as she mentioned earlier, the Governor's Nursing Shortage Task Force really had, two primary goals. One is to study intent to stay, and the second is to design a culture of excellence designation program. So we had a pretty large committee working over the last 2 years, figuring out exactly what we wanted to have in this culture of excellence. We wanted to define what the ideal work environment is for a nurse for recruitment, retention, and to really design that culture. So we utilized the results from this study, and we also had numerous groups and a retreat early on to develop this program, which allows employers the opportunity to work together with all levels of nurses to promote the positive workplace culture and environment. And so the idea is that we would work with employers along the path of attaining the criteria, and then eventually they would receive the designation, which would signify an environment that really promotes nursing recruitment, development, and retention. Next slide, please. Rhoda. Oh, there we go. So okay. One of the key parts of our system is the establishment of a professional identity in nursing. This is a pretty new concept. As a matter of fact, Dr. Owens is on an international group that's working on this. So this system is pretty cutting edge, but it's really establishing yourself and your professional identity along domains of values and ethics, knowledge, leadership, and professional comportment. So that is a key part of our criteria. Next slide. So we actually, thanks to pilot study funding from Blue Cross Blue Shield Caring Foundation, who also helped fund our initial retreat, we have 3 pilot facilities that is working on our criteria right now to see how it works, so that we can eventually launch the full system. So that includes McKenzie County Health System, Minot Health and Rehab, and Wishick Living Center. Next slide. So what are some of the benefits of becoming designated? Well, what we decided to do was, rather than just develop, here's some criteria, good luck, come back to us when you've figured it out in your facility. What we wanted to, as a committee and as a large group, is to give them the criteria and the ideas on what they need to do, but also to provide them resources. So we've developed, as a committee, several resources, including webinars and resource sheets, etc., to help them actually implement the system. We also have a customized data collection and analysis system developed that will collect baseline and at 1 year interval data along many different measures that is designed to measure each of the criteria to provide those facilities with that feedback as to how to incorporate the criteria and how the system itself is working in their facility. So we also have continuing education mapped to the system, and they also have access to that statewide group of nursing workforce experts. So we had lots of different people design the webinars and the resources for the facilities, and so they'll have access to that as well. Next slide. So for the pilot study and eventually the launch, we intend, of course, especially initially, for facilities to be in North Dakota, but we really designed it to not only be applicable to like large hospitals, but certainly small hospitals, clinics, long-term care, home health, hospice, and public health. And basically, the facility, in order to participate in the full program when it comes out, it needs to be committed to implementing these nursing standards and improving their workplace culture. Next slide. So here's a list of the designation standards that we've developed. They go along 11 practice standards. So they include things like I mentioned, professional identity in nursing, looking at civility and respect, looking at scope of practice and other regulations, interprofessional collaborative practice, shared governance, professional development, staffing and scheduling policy, culture of safety, recognition and promotion of nurses, healthy work-life balance, and a competitive salary and benefits package. Next slide. So when the full program is launched, the idea is they would apply to pursue the designation phase. They would be part of a preparation phase. We're thinking it'll be about a year, but it might be longer as they work through the standards. And then they'll put in a formal application. There'll be a site review, and then they'll be designated for 3 years as a designated employer. Next slide. So next we'll have Ricky Ramlo to provide some information about the importance of workplace culture at a rural hospital.
Test.
Yeah, we can hear you.
Okay. And next slide. Thank you, Rhoda. I'm Ricky Ramlo. I'm the Chief Operating Officer at Jamestown Regional Medical Center, and I am here to share just some application and some tools for your toolkit today as maybe helpful resources for you. A little bit about Jamestown Regional Medical Center. We are a 25-bed critical access hospital. We have 350 employees. We have been named a top 100 best places to work in healthcare. And in 2021, we were named a top 20 critical access hospital in the nation. The makeup of our community of healthcare providers is we have 2 primary clinics in Jamestown. We have Sanford and Essentia, and we also have a urgent care clinic called Medallis. And at JRMC, those providers provide the primary care, and at JRMC we have a specialty clinic with practicing physicians in orthopedics, ENT, urology, podiatry. We have 4 emergency department physicians and gynecology. We have mid-levels who also serve in ortho, wound care, and we have several CRNAs for surgical services that we provide. We also have a JRMC Cancer Center to serve our region, and that is in a partnership with Sanford and Roger Maris Cancer Center in Fargo. We have 2 visiting oncologists that come to Jamestown and serve our region. And we have an on-site nurse practitioner that is employed by Sanford. So we have partnerships where we work with the larger tertiary hospitals. We also offer a full cardiopulmonary rehab program, and that has been important with our pandemic and rehabbing individuals who have had the COVID-19. We have a full rehab department which has physical therapy, OT, speech, and audiology. We are very fortunate to have an on-site radiologist, and of course, many more services that we offer. And so, Rhoda, if you would mind moving to the next slide. So as I had mentioned, I am providing application of some key strategies that we're going to cover today. You'll also notice that we're going to stay on this slide, but we will have several slides that we will pass through because the information has been provided to give you resources. So today we're going to talk about employee engagement and retention strategies, candidates and realistic job previews, how shift schedules and those expectations. I have a number of slides that are for your use to take away from this, are standards of behavior. And then I've also provided slides on initial and peer interview, a little bit on safety culture, resilience, focus groups, and community connections as we're able and as time permits today. And so you can stay thank you, Rhoda, you can stay. So we're jumping right into our agenda. We'll start with employee engagement and retention. Candidates, one of the key factors is candidates and having realistic job expectations and presentations that feature the shifts that they will work, the schedules that they work at, and set expectations early on so that everyone understands what has been posted and what an individual is applying for. We'll talk about our standards behavior, and as I've mentioned, we'll have several slides for you to take away today. We will spend some time on our initial and peer interview. Some of the key drivers in employee engagement are the work that we do, including the desire to develop in a role, as Patricia and Rhoda have talked about today, confidence and trust in the leadership of the organization, recognition for a job well done and rewards, and cascading communication in a timely and thoughtful manner. One of the key factors that we would want to watch for in employee engagement is transactional engagement, and that is where an employee appears to be engaged by working longer hours and even responding as such in engagement surveys, but are not actually engaged. Transactional engagement is associated with negative well-being and outcomes such as they're burnt out and, a fair chance of departure. Very important is an employee's well-being, physical, psychological, and social, which includes their overall health, stamina, and energy, the stress that they're feeling, their confidence and control, and then social also making, trying to encourage work-life balance, equity, respect, and connectedness. Of course, well-being can also be impacted by other circumstances outside the organization, economy, what's happening with Mother Nature. And key contributors that we're aware of is the manager and employee relationship for employee engagement, that there's open and consistent, and you'll hear me say consistent several times throughout the presentation, open and consistent communication, supportive of the employees, and learning employees' love languages and showing appreciation and gratitude. And I would just share that does not have to be expensive or time consuming. It can be just a simple greetings in the morning and fetching coffee or water for a coworker. And then something that's always been important to me is having a high degree or engaging or reverent communication with the individual and learning about them and their families and their likes and dislikes, and just having casual conversation. And then as we move into retention, and Rhoda, you're doing good, just so you know, as we move into retention, one of the key factors is, again, being clear with job responsibilities and making good decisions so that the employee can make good decisions on the available job, sharing job functions clearly, and communicating the tasks that are featured in those jobs. And this helps ensure a good fit from the start. And as a piece of retention then is recruiting the high-performing employees, and they start with a clear definition of the knowledge, skills, and abilities required for the job, assessing qualified candidates for cultural fit, and offering competitive compensation and benefits. And Patricia talked a little bit about that, and Rhoda also helps in recruiting and retaining top talent. Or we're going to talk a little on compensation here today too. Organizations lagging behind the marketing, compensation, and benefits are often challenged with retention. We will talk I will be sharing our compensation philosophy again so that you can have a tool or resource to build a compensation philosophy. Excuse me. As discussed, realistic job previews and responsibilities are often included in the selection process. And ongoing assessment of employee engagement, a couple of metrics for engagement are employee surveys to determine attitudes on the organization, turnover and pockets for potential improvements on functional units, and thoughtful or mid-year stay interviews and conversations with your employees, not just during the annual assessment. We'll be sliding through some slides here on the current standards of behaviors. Our standards of behavior and values include attitude, communication, compassion, and you can advance it. Communication, attitude, communication, compassion, customer service, respect, teamwork, appearance, safety, and accountability. Additional tools in the hiring practice would start with in our organization, we use a hybrid model of a structured interview and a behavioral-based interview. In a structured interview, each candidate is asked, and if you want to advance, Rhoda, I think we'll advance through a few standards. These are our standards of behavior expanded. And these are a resource for the attendees if they would like to have a place to start as they maybe would look at building their own. Just wanted to share those. Thank you, Rhoda. There's probably about, there you go, perfect.
We're at, okay.
Thank you. Initial manager interview. In a structured interview, each candidate is asked the same group of questions for fairness. And that's why ours is a hybrid model. And in a behavior interview, we focus on how the candidate previously handled situations or real life experiences. Also, as you're preparing to post positions in the organization, one of the things that we do is the manager reviews the job description. It's an opportunity to take some time to review the job description and make sure the job analysis and job description for the position are accurate. Excuse me. The manager in the initial interview is also assessing the candidate for time management, possibly prioritization of tasks, communication, critical thinking skills, teamwork, and leadership. If the candidate is found to be a viable candidate from the initial initial interview, they are referred to a peer interview. Peer interviewing is the process of engaging your high-performing teams in the selection process. Your staff know who will best be a good cultural fit in your organization. The peer interview team typically consists of high performers in the department, and they make up those who either work directly or closely with the candidate that's being interviewed. You'll want to try, again, these are some hints that we use in our organization. Try to keep the size no less than 3, but no more than 6. Again, considering the participant, and not get the group too big. The individuals on the peer team will model the values and standards of your organization and have a clear understanding of the organization and have good communication skills and listening skills and are your trusted coworkers. And then, as you'll see on the slide on the screen, another retention tool includes 30 and 90-day meetings. And I have shared with you, you'll see here, these are 30-day questions. Is the position what you expected? Do you have the tools and resources you need to do your job? Can you share with us what's been working well? Was the job presented what you expected the job to be? Is there any reason you might not find this to be a right place to work? And these are our opportunity to address any concerns that might be looming. And then in the next slide, if you would, Rhoda, please. I think it talks about our 90-day meetings and how do we compare, again, how do we compare? This is re-recruiting that new hire. How do we compare based on your prior work? Do you have ideas for improvement? Do you know of anyone else who would be a good fit for the organization? And as a supervisor, is there anything I can do to help you? And then Rhoda, if you want to move to the next slide. So some of the, I provided some information on some of the things that are most important to that we've identified for our employees are a few consistencies with our policies. Some policies that have been targeted in our organization and are very important to our employees are attendance and tardiness, leave of absence, meal and rest breaks, wage and salary, and weather and storm policy. And again, these were targeted because employees really felt that we needed to be consistent across the organization in the application of these policies. One of the things I would encourage is that if you have a policy or need to create a policy, if it doesn't fit or work, then you need to revise it. And ensuring that it's consistent and consistently applied across the organization is very important. And then also, are your policies easily available to your employees? And do your employees understand your policies? Do your employees perceive the policies and systems to be fair, adequate, and consistent? And we're going to talk about focus groups, but those are some of the things, these are some of the policies that came out of our organization's focus groups that we needed to pay particular attention to. And then Thank you, Rhoda. And then additional tools for you to include some information on for you is our compensation philosophy and compensation system. And as you've heard throughout the presentation, compensation and benefits and total reward systems are very important to the employee. So designing and establishing a compensation system is important. I've also shared with you, and you're okay to stay where you're at, Rhoda. I've shared with you how pay scales and bands will work, and we'll talk about that here shortly. And I've also, also talked with you about compensation philosophy. So the first thing that's important when you're developing a compensation plan is have a job analysis completed. HR should have a clear understanding of what it takes to perform a particular job in the organization. An analysis is determining activities and tasks to perform a job, not reviewing one particular individual working in the job, not just one, and the knowledge, skills, and abilities to perform the job. The ways to complete a job analysis are direct observation, interviews, asking questions, talking with the staff that work in those jobs, the supervisor of the job, and keeping a daily log of tasks. Job documentation results from the job analysis process. Likely includes a job description, and all of our jobs have a job description that have the minimum qualifications and job specifications, and then the job evaluation. And we'll talk a little bit about that as you're trying to place on a pay scale, determine the ranking and placement within your organization on your pay scale and job families, and examining internal markets and equity within the organization, and also external survey data and markets.
We have about 5 minutes left, just to let you know.
Okay, thank you, Tracy. I appreciate your help. As you look through your compensation system, you're developing your philosophy based on lag, match, or leading the market, and could vary based on supply and demand. Most organizations use a combination of strategies. Examples for us are critical jobs and competencies. You may need to match or pay at the medium, or even lead to be competitive in those talent pools. And we choose to match the median of the market on most of our positions, depending on the ability of supply and demand and recruitment. Review your compensation mix of total rewards. And your total reward systems is your compensation, benefits, and other incentives and bonuses. And then we'll just flip quickly through, because and then I wanted to show you that I have provided our compensation philosophy. Again, you can use it if you like. I've also, this screen, thank you, Rhoda, is that was just a snapshot of the wage scales and bands. This happens to be our clinic clerical. You'll see that the pay grades move down by 1% vertically, and the spread in those ranges is 35%. And this is just a snapshot of one of our job families. We have 5 job families in our organization. And I've also, in the slides, I've shared some information on a safety culture, which is very important for our healthcare organization, and prevention and reporting, resource and teamwork, pride and reputation, and resilience and I talked a little bit about my work is meaningful and can I disconnect? And this is, again, work-life balance. And then I spoke just briefly on focus groups, areas for discussions and improvement. I rely heavily on small work groups and hearing from where are some areas we need to focus on to help make it a best place to work. And then one of the very most important things is in our community, we're a leader in our community, and we spend a lot of time on our engaging with our community. It also helps as an employer of choice, along with a positive image of your organization. So I hope you find the information and my role today as helpful. I wanted to provide you actual resources to get you started. Thank you for having me.
Well, thank you so much to our presenters.